Hello, my name is Mr. Vikram Dar. I'm an ENT and head and neck surgeon, and I wanted to tell you a little bit about a total thyroidectomy. That's an operation where we remove all of the thyroid gland. There can be several indications for this, and your surgeon and physician will tell you about that. Primarily, that is to remove the thyroid in thyroiditis, such as Graves' disease, or to remove it because of it's very bulky and pressing, often going down into the chest. Those are usually multinodular benign goiters, so lumpy thyroids, or there's a concern about cancer. The operation is very similar to the hemithyroidectomy I've discussed in the other video, but in case you haven't watched that, I'll run through it all. So we make a low neck crease incision under a general anaesthetic. That means you'll be asleep, and the incision will be kept as small as possible, but big enough to make sure we can see everything, at least 5 centimeters wide in the neck crease, as I mentioned. And then we dissect down to the thyroid gland, and we aim to keep two very important structures. The parathyroid glands, there are 4 of those, and those look after parathyroid hormone production, which is very important in calcium metabolism. The chances of those being damaged after surgery are said to be about 5% in a permanent level, so that means that even after 6 months the calcium can be low, and in my experience it's much more the case in diseases such as Graves' disease. Temporary low calcium levels due to parathyroid hormone, parathyroid gland injury are about 20%, but they do recover and sometimes do need some calcium supplements in the short term. We do monitor your calcium closely, and I tend to get a 6-hour calcium and parathyroid hormone blood test and a calcium blood test in the morning just to make sure it hasn't dropped. And the reason why these parathyroid glands are damaged is that they're tiny little glands at the back of the thyroid, the size of a grain of rice, and there are little blood vessels that supply it. And particularly in, as I said, in Graves' disease, that blood supply can be injured and cause a problem. The other very important structures that we look for, the recurrent laryngeal nerve, and we always use a recurrent laryngeal nerve monitor. That nerve looks after the vocal folds, and when it's injured, one of the vocal folds may not move as well. I would say that the chance of permanent one-sided paralysis is less than 1%. I always check the nerve to make sure it's stimulating perfectly on one side before proceeding to the other. I do not proceed without checking. And if you do and damage both, which I've never seen before, but it's a theoretical risk, you can end up with a tracheostomy because neither of the vocal folds are moving. There's also a little nerve called the superior laryngeal nerve that comes at the top of the thyroid, and in about a third of patients it runs into the thyroid tissue and can be damaged. I do look out for it. If it is injured, then it can cause problems with pitch elevation and throwing a voice, and I find this an issue particularly with patients who are teachers or singers who need to throw their voice or elevate the pitch. Of course, if you've had a thyroidectomy, you're going to need a total thyroidectomy. You're going to need to have thyroxine supplements afterwards. We usually calculate that at 1.6 micrograms per kilogram, but it can be changed afterwards after a blood test of say 3 months. As with every operation, there are risks of bleeding and infection, and we put a little drain in overnight to ensure blood doesn't collect, and infection is very low risk, less than 1%. I would say it's quite a painless operation. We do put long-acting local anaesthetic in, but of course it'll be a little bit uncomfortable. After 48 hours, we try to get the clips that we put in the skin out, and after about 5 days, the steri-strips that are put on after the clips come out can be taken off with some water, and you can start getting back to normal activities really after 2 weeks. Anyway, I hope you found that useful.